Dr. Annu Jayan. I am a practicing dermatologist at Cochin. I have a clinic called Skin and Hair Lybrate Clinic. Today, I would like to talk to you about acne vulgaris. Acne vulgaris is one of the commonest complaint or concern among not only young girls or boys but also college going adults as well as office going or even housewives from the age of, let us say, around 10 or 11 to even up to the age of late 20s or early 30s. There are of course multiple causes for acne. Now, what I see among my young patients is they have a habit of picking their acne, or sometimes they don't use any medications for acne. When you apply a medicine for acne, it heals faster. Thereby, there is less chance of any of the complications to happen. Most commonly, the complications or sequelae of an acne or a pimple is that it leaves behind post-inflammatory hyperpigmentation or a black or brown spot, or sometimes scars. Now, the post-inflammatory hyperpigmentation or a brown spot may disappear on its own without you doing anything actively, but a scar will never disappear. You will further need some laser treatment or derma roller treatment or as such. So, isn't it better to avoid the scar formation by applying some medication? I see a drastic reduction in the complications of acne if you apply the right medicine at the right time. Adapalene and benzoyl peroxide combination is one of my most favored combinations or medicines which I use for acne. I usually advise it every night on the pimples and wash it off the next day with a good salicylic acid containing face wash. But when it happens to a younger skin, like let us say 11-year-old or a 12-year-old coming to me with acne, I don't recommend an overnight application. In fact, I recommend a short contact therapy, let us say maybe 2 hours or 4 hours after sunset, and that is enough to give a good clearance of acne. In fact, let us say if I am doing a laser treatment for hair removal or anything like that, I see that heat can actually induce a lot of acne, and this can further cause scarring, etc. So after doing certain procedures which I know is going to reduce heat, and if the patient is acne prone, I recommend the set combination short contact therapy of 3 hours or 4 hours for some days after the procedure. And sometimes I usually give it even for 4 hours for a long term in repeated comedones or patients who are having repeated whitish, blackish, etc. So it is important for you to understand that using the medication will prevent the sequelae or complication to a larger extent. Thank you.